Hey y'all, it's Chardá from Melanin Milk SD, Doula and Lactation, and today I want to give you a little lesson on what you need to prepare for education on induction. I get a lot of questions about induction. I want to give you a couple of tips on what to do if your doctor or your provider starts talking about induction and what that looks like. Stay tuned if you want some tips. Also, you can check out my blog or you can sign up for my mailing list. To prepare for birth, the cervix begins to soften or ripen or thin out and open. And these changes usually start a few weeks before labor begins. And sometimes when labor is going to be induced, the cervix is not yet ripe or soft. And that means we're not ready to have a baby. Induced labor is the use of medications or other methods that are used to stimulate contractions of the uterus. This can be a really lengthy process and it's longer than the average spontaneous birth, especially if your cervix is not ripened, softened, and ready to go, or if you or your baby are not ready for this process to happen naturally. So ripening the cervix is a process that helps the cervix to soften and to thin out in preparation for labor, and medications or other devices can also be used to soften the cervix so it can stretch and dilate for labor. So a few methods that are used to induce labor or to begin an induction process at the hospital would be a membrane sweep, also known as stripping the membranes. The doctor will take a gloved finger, y'all. So they take their gloved finger between the amniotic sac, the wall of the uterus, separating the fetal membranes from the cervix. And this can be done in the doctor's office, at an appointment when the cervix is partially dilated, and this may cause your body to release prostaglandins. Prostaglandins are a medicine that's used to ripen the cervix, also known as misoprostol, or the brand name is Cytotec. Cervidil is another one that's commonly used here in U.S. hospitals for inducing labor. These medications can be inserted into the vagina or taken by mouth. Prostaglandins are not good for folks who have had previous cesarean deliveries, or I like to call them belly births, or uterine surgeries, to avoid increasing the possible risk of uterine rupture or tearing, which is very common if you administer pitocin with any of those conditions. Prostaglandins will help soften the cervix and may cause some contractions. Pitocin is an artificial form of oxytocin. It's a hormone that can cause contractions of the uterus. It can be used to start labor or to speed up labor that has already begun on its own. Contractions usually start about 30 minutes after pitocin is administered, and once you get it, they slam you. They slam you harder than normal contractions, so be ready for that intensity if you opt into the pitocin. I know because I've had a birth with and without pitocin, so I know what that is like from experience. It is a lot more difficult with pitocin. The pitocin can be turned up or down. It can be turned on or off at any time. And don't let them fool you. If they tell you no, you question that. You ask, how high are you putting it? How much dosage are you giving me? They usually will say something like, we're going to give you the lowest dose. Ask them to clarify what the lowest dose is. Do your research, look in my blog. There's information on pitocin. It's not a scary drug or medication. It's not something that we should say don't use. It's just something that we should say use with caution and proper guidance. And informed consent and education, which is why I'm here. Talk about elective inductions. Now, sometimes people or providers plan inductions for non-medical reasons. Maybe you live in a really rural area, or people may feel physically uncomfortable in the pregnant body over time. 41-week birth givers may start to feel pressure from their medical providers to medically induce their labor. Whatever your situation may be, you might be wondering how to induce your own labor at home naturally, rather than go the medical route, if it is safe to do so according to your midwife or your doctor or your care provider. So there are several natural induction methods that can be helpful for jump-starting your labor. A natural induction can be attempted on a healthy, full-term pregnancy. So how can you begin to safely and naturally encourage your own labor to begin? When your baby's lungs have matured and the proteins are released, this is when you want to speak with your midwife or doctor to begin the process of natural induction. Around 38 to 42 weeks is when the baby is considered full term. Do not attempt any of these methods or techniques without medical guidance from your healthcare professional or healthcare team or provider. I'm not a doctor or a physician. So with that being said, let's talk about nipple stimulation. Nipple stimulation can be done by you or your partner with hand massaging. You can also use a breast pump to stimulate the breast. And so many of these methods release oxytocin, which is a hormone that can ripen the cervix, as we've already discussed, and it causes uterine contractions before labor as a natural induction method or during labor to increase your contractions. And so this natural induction method or technique has been pretty well studied, and it's important to understand that nipple stimulation can be very powerful, and so there's no way to control the amount of oxytocin that is being released during the nipple stimulation. And because of its effectiveness, you always want to check with your midwife before you attempt nipple stimulation as a way to induce labor. Check with your doctor and make sure that it's okay and safe for you to do that. Never do that before full term. You want to wait until after full term and always ask your doctor, but it is a very effective form. Acupuncture. Studies have shown that acupuncture can help with cervical ripening. Check with your midwife. Use a trusted professional that practices in the field of Chinese medicine. Chiropractic care. So many studies have shown that chiropractic care, particularly the Webster technique, is beneficial for pregnant folks, especially those who experience lower back pain, which can help loosen the joints in preparation for a smooth delivery. As a natural labor induction technique at 40 weeks, stimulate your parasympathetic nervous system and activation of the acupressure or acupuncture points that ripen the cervix. And so manual therapy to relax these ligaments and the uterus and pelvis can be done. Red raspberry leaf tea. It's probably one of the most common things that I get asked about as a doula. Should I take raspberry leaf tea? Is it okay? Is it safe? This is an herbal tea. It might tone and strengthen your uterus, and some midwives recommend to drink it about at 32 weeks. This gives it time to build up in the body. So you want to start with 1 cup a day, gradually work your way up to 3 cups a day. The evidence on it is limited, but so far the research shows that there's no harm done to humans. So drink the raspberry leaf tea if you think it's helpful and your midwife says okay. Otherwise, don't feel the pressure to start drinking raspberry leaf tea every day all the time until your baby comes, because maybe it's doing nothing, right? To each their own. The last way that we can try to naturally induce labor, let's talk about sex, baby. Sex is a way to induce labor. Yes, it is. There are 3 possible ways. 3 possible release of natural oxytocin from orgasm, which then releases oxytocin, prostaglandins in the semen. Work their way into the cervix. Boom! You're in labor. It doesn't happen like that, but that's what we would like it to happen. That's the way we would like it to happen, because some people it works. I have tried it with that didn't sound right. I didn't try it with a client. I recommended it to a client and they did it and it worked. And they were really trying to get things going, and they had done all the things. They had done with doctors and midwives' permission. They did raspberry leaf tea, they did nipple stimulation, they did acupuncture, they did all the things. Nothing was working. And she was at 40 weeks, and she was really, really just kind of getting very uncomfortable in the body. And last hurrah, we had a conversation. She didn't want to get induced. I didn't want her to get induced. So I said, go have sex. Try to have sex if you feel up to it. If you feel like you can get that thing going, then do it and see if it works. But, I'm getting some. Specific job you have is to get that semen to the cervix. The prostaglandins need to wiggle their way in there to release. and get that oxytocin going to help labor to begin, for uterine contractions to start, and for things to start progressing. They called me, the next morning, had the baby that same day, and everything was great. So sex works in my book.